Good afternoon, this is TTT Live and TTT Live online on Facebook. I'm Dike with a COVID-19 review. A warning to members of the public that now is not the time to be complacent with regard to COVID-19. This as the nation gets a further breakdown of who is being considered high risk, especially in light of the non-communicable diseases or NCDs prevalent among our population. Nephrologist and acting head of medicine at the San Fernando General Hospital, Dr. Neil Bagwandas, told the daily COVID-19 press conference that while older people have been deemed high risk, people of all ages who have certain underlying conditions are equally at risk. He noted that there are many citizens who suffer from hypertension, which can put their life in jeopardy should they contract COVID-19. But he said renal issues in particular seem to be on the rise.
When we speak of complications of COVID-19, we especially did talk about respiratory conditions such as severe respiratory distress syndrome, respiratory failure, having to end up on ventilatory support with the attendant risk of high mortality rate. Other complications of COVID-19 in our high-risk populations being recognized now is an increasing risk of going into acute kidney failure if you develop severe COVID-19 infections and you require dialysis.
Dr. Bagwandas stressed that young people are not immune.
Many young people who do not manifest any of these comorbidities as listed on this slide, young people are being diagnosed with strokes, cardiovascular accidents because of prothrombotic or increased clotting disorder that occurs when you develop COVID-19 infection. So all the reasons why we should aim not to put ourselves into a high-risk category or expose ourselves to COVID-19.
Some of the underlying conditions that put people in the high-risk group include asthma, chronic lung disease, diabetes, and severe obesity. As of this morning, the number of confirmed positive COVID-19 cases remains at 115. A total of 41 patients have been discharged from hospital. The world has recently seen a precipitous drop in the West Texas Intermediate or WTI crude oil price. Energy analyst Nisha Ramdas, who we spoke with yesterday, explained why this has happened using the simple laws of supply and demand, plus storage capacity at the production point in the United States.
So if they're running out of storage now and contracts are ending, supply contracts, then they're going to have this buildup of oil just there stored. They're basically paying people to take oil off their hands so that storage will be freed up, because it will cost way less to pay people to take the oil off their hands than to actually stop production. Because once they stop production, companies start to suffer in a huge, huge way.
Now, Ms. Ramdas spoke locally to Heritage Petroleum Company as using a different approach, choosing to store the oil it produces rather than sell it at cost price. She said that attention should also be placed on natural gas and its derivative products like ammonia, methanol, and LNG. The energy analyst points to the fact that TNT is at a pivotal stage and should use this moment to take the hard decisions that should have been made a long time ago.
At this point, we need to weather the storm. Honestly, that's what I think. We need to weather the storm. We're at a point right now where this is a pivotal point in history, especially for us. And I think that we should use this now as an opportunity to do all the things that we said we were supposed to do in the past. So we were supposed to diversify the economy. We were supposed to have a transition to renewables. We were supposed to diversify our energy mix in Trinidad and Tobago so that we won't be so dependent on this one commodity, where if this commodity drops, our economy drops. If this commodity falls through, our economy falls through. We shouldn't have all our eggs in one basket. And I think this is a learning point for us.
We take a short break. When we return, we speak to post-COVID-19 process and priorities with Afra Raymond. Please stay with us. Welcome back to this COVID-19 review. Afra Raymond is a chartered surveyor and a public policy campaigner. He is on a meeting with us via Zoom to speak about post-COVID-19 process and priorities, as well as some possibilities moving forward. Good afternoon, Mr. Raymond. Now, I want you to start off by expanding on your statement that we should never let a good crisis go to waste.
Okay. Well, good afternoon, Dike, and good afternoon, viewers. Thank you for the opportunity to speak on this important issue about the post-COVID recovery team appointed by Prime Minister Rowley on the Thursday, the 16th of April, 2020. The question of letting a good crisis go to waste is a pregnant phrase which was birthed in the sad history of how disasters and crises have treated resources and humans in our history, well documented. Naomi Klein has the shock doctrine, and there are many scholars who've written about it. Transparency activists and transparency workers know that the greatest opportunity for white-collar crime is in the midst of a war or a crisis, whether it's a natural disaster or man-made, because there's a desperate need for assistance. The general circumstances are desperate, and the normal arrangements are very often set aside. So you have an opportunity for people to make mischief with the public purse, with public health, and with important issues of public safety, equity, social and economic justice could be at stake, and very often is at stake in these situations. So the 2 points I wanted to advance, Dike, were firstly that the post-COVID recovery committee appointed by Prime Minister Dr. Rowley should represent an opportunity for us to do something different. We're facing a very different set of challenges. We've never faced a challenge like this. Is a perfect storm. On the one hand, we have a steep decline in the country's revenue. We know the oil and gas scenarios and so on. Secondly, we have tremendous calls on the public purse, the treasury. People need assistance, whether they're business people or working class people. People need assistance. And thirdly, we have a situation that, to put it simply, we don't know how long this will go on for. Those three things together, I think we need a new going forward. And what I wanted to say as my first point is that whatever that committee decides, and people have made points about the composition of the committee and the membership and so on, and those are the points I want to advance. The first point I want to advance is that the work of that committee and its reports, its draft reports and its interim reports need to be published. In the same way that we have the Minister of Communications and the Office of the Prime Minister making frequent use, daily use of press conferences to broadcast what is the official position. We need to keep up that tradition of communication and broadcast what are the work and the findings and recommendations of that recovery committee. That's the first thing.
All
so
right,
the findings of the committee can't be held.
I want to ask about that point though. What will immediate publication of that first draft and the subsequent drafts coming forward hope to accomplish?
Well, what we want to have, quite simply, is the citizens must buy in. Again, to choose Dr. Rowley's pregnant phrase, we are all in this together. I couldn't agree more. We are all in this together. Regardless of the various legal challenges and political statements and so on, we are all in this together. From the careless neighbor who sneaks out for a drink to the person who doesn't wash their hands, we're all in this together. And certainly in terms of recovery going forward, we hope the country does well. We don't wish ill on anybody. But if we're going to go through this together successfully, we need to do so transparently. So that's where I'm coming from.
All right, so I see the thing all in it together, but sometimes I want to advance the possibility that too many cooks can spoil a pot. And sometimes the pot may not be spoiled, but it may take much longer to cook. And we know what happens while the grass is growing.
Absolutely. But I just want to say that our resources are limited. The calls on the public purse are tremendous. and there must be transparency. There's to be confidence. People are being asked, whether they're business people or working people who used to work at KFC and McDonald's, people are being asked to make a sacrifice at every level in the society. And if the sacrifice is to be shared, the solutions are also to be shared.
So with that in mind, how do we move from personality to process? And in asking that differently, what do you suggest we put in place to create a pattern of disclosure, transparency, as opposed to having a one-off whistleblower?
Well, yes, I don't believe that we need to dwell in the territory of the whistleblower. We recognize that the whistleblower was necessary in the past because of the system we had all participated in of official secrecy. And I have been very careful throughout all of this. The only name I've called is Dr. Rowley. Obviously, the gentleman is the head of government, and he's the one who announced the post-COVID recovery team. I'm not interested in speaking about the other people on the panel. Many of them have given good public service in the past and so on. We need to have a new approach to this, and that new approach has to be based on citizen participation, citizen information. The second point I wanted to make, Dike, if I may, because I know our time is limited. The second point I wanted to make relates to the question of priorities, because you want to move past the personality. And I started off by speaking about the shock doctrine and the fact that during crises and disasters, there's wanton abuse of public funds and a growth in inequity. What I want to say in relation to that is that we've worked very hard to produce a public procurement and disposal of public property act, which was passed in Parliament as the first act of 2015. That act is this close to being implemented. Finance Minister Imber told us in February that there were some small amendments he wanted to take to Parliament to pass that act and put it fully into implementation in March. Of course, the COVID crisis overtook this, it eclipsed it. And I asked the question, I paused to ask the question, did it? Or is this not the opportunity we should not let go to waste? Because the fact is, if we spend $100,000 6 months from now to buy meals for the underprivileged or tires for the police service, I would like to know as a taxpayer that we're getting $100,000 worth of meals and we're getting $100,000 worth of car tires for the police cars. And that is the basis on which I'm making that second recommendation, that the first priority coming out of the recovery team is we need to put the bad old days behind us. We need to implement the Public Procurement and Disposal of Public Property Act, operationalize the Office of Procurement Regulation, put things in place to safeguard our scarce public money. Unless we do that, we would look back on this moment in sorrow.
All right, I want to thank you very much, Afra Raymond. There are many people who have been bogged down in the actual composition of the committee. Thank you for helping to take the conversation forward in terms of what that committee, the output that committee is expected of delivering to the populace of Trinidad and Tobago. And that is what is trending on COVID-19. Remember, you can join us for live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant.